How to have healthy teeth without visiting or using a dentist. This may seem quite a peculiar statement because everybody knows that it's necessary to visit the dentist if you do want your teeth and your gums to last you a lifetime. However, you might be in a situation where, for example, you can't get to the dentist over a period of time, or for example, you cannot afford to go at this present moment in time. So obviously you don't want to have a barrage of problems when you do finally go. You want to minimize the problems and you want to reduce the risk of any problems occurring. I'm not advocating that you don't go to the dentist, and one of the most important reasons to have a dental checkup is so that the dentist can check your mouth for any oral cancer or any pre-cancerous mouth lesions. The other reason which is important is so that the dentist can spot early problems which you will be totally unaware of. Decay being one of the problems that can be detected early by looking at your teeth, looking at your fillings and taking x-rays. Decay in the early stages and sometimes even in the latter stages is fairly painless, so most of the damage can occur in these stages when you're not even aware. This is the same with gum disease, where gum disease is on the whole fairly painless until you start getting gum abscesses or your teeth get loose, and then it is too late by then. Another important overlooked factor apart from mouth cancer, decay and gum disease is tooth wear. So tooth wear is where your teeth have become weaker because they may be cracking or chipping or just wearing away. There's lots of different reasons why teeth wear away, including grinding or clenching your teeth, but also the use of fizzy drinks if consumed to excess, and that acid can wear away the enamel of your teeth. So if we put all that to one side, let's look at how you could have healthy teeth without visiting your dentist. We're going to be discussing the 5-2 rule, the best times to brush your teeth, the importance of the sugar intake frequency, the use of a particular chemical to combat gum disease, the best way to reduce sensitivity from your teeth, and finally, if you do get a real dental problems, what you could do in those circumstances. Okay, so let's look at what you could do before you've even taken out your toothbrush. So, when is the last time you actually stood in front of a mirror and carefully looked at your teeth, at your gums and the general condition of your mouth? You can start off with looking at your tongue. This is because the tongue is the most common place where you will get mouth cancer. Mouth cancer can occur anywhere, but the tongue is the most frequent place, and it is the side and the underneath the tongue which are the common areas here. So you would stick your tongue out as far as possible and look at the front surface with a mirror, in the mirror. It should be a fairly uniform pink colour, although some people get a white coating on their tongue, which is still fine. You're really looking out for any particular red patches or where the colour is uneven, or any lumps or ulcers. You would do the same by examining the side of the tongue, left and right in turn, and finally you would stick your tongue to the top and back of your mouth and look underneath the tongue as well, very, very carefully. If you do this on a regular basis, you will soon get to realize what the normal appearance is, and if something sinister was appearing, you'll be able to identify it. You must do this in very good light, and if you can get a pen torch or one of those bright LED torches, that is really, really useful. The next thing you can look at is the condition of your teeth, and the best way to start is as a dentist does it, where the dentist reads out numbers and looks at each particular tooth in turn. So you would start off with your front tooth, for example at the top first. You can lift your lip up and examine it very, very carefully, and you're looking if there's any fillings. Do the fillings look discoloured? Is there any discoloration around the filling? Are there any black marks anywhere? You're also looking to see if the teeth are discoloured generally more than the adjacent teeth. If a tooth on its own has discoloured more than the adjacent tooth, there is usually a reason for that. It could be that the nerve is dead, or it could be that it's already had a root canal treatment. It's important to see if there's any cracks or chipping or any wear on the teeth that you have noticed. So you would examine, for example, the top left front tooth, and then you'd go on to the next one, and next one, and next one, and so on. And then obviously you do your lower teeth as well. You are limited to what you can see because it's difficult to see the upper teeth on the inside, for instance, unless you use one of those mouth mirrors. But even then it's quite difficult because obviously as a dentist, it's, dentists can do this with their eyes closed, but you won't be used to it. You will find it difficult, but you just do the best you can, and you try to see if there's anything unusual or anything that you're worried about. If you do this regularly, if there's any changes, you can easily spot them. With your gums, the best way to examine them is to move your lip out as much as you can and examine the immediate area around the neck of the tooth, but also about a couple of centimeters above that as well, to make sure there's no ulcers or any abscesses or any redness or any small swellings or changes in colour of the normal pink healthy gum. You can also compare a region of a gum compared to another region, so if it might look more swollen, or it might look more red, or it might even ooze a bit of blood, possibly if there's any gum problems. You're not going to diagnose any gum problem, but this is just to alert you if anything is going on, or if there's anything unusual. So let's look at the 5-2 rule. So the two most important things to increase the longevity of your teeth and gums are your brushing and your sugar intake. So the 5-2 rule is based on both of these habits. 2 stands for brushing twice a day. 5 stands for no more than 5 daily exposures to sugar. So twice a day brushing means that to keep your teeth in an optimal condition, you need to be brushing twice a day. You can brush more, which is better, but twice a day is the minimum. And the 5 times daily sugar intake means that you should not be having more than 5 sugar exposures to your teeth in a day. So virtually, you can assume that virtually everything, every meal and every snack will contain some sugar. So you know that the common source of sugar is not the open sugar that you see in a packet, but hidden sugar. So for example, foods that you never even thought would have sugar in do contain sugar, such as tomato ketchup, baked beans, pickles, sauces, even some muesli type cereals, yogurts, fizzy drinks, orange drinks, fruit. So it's virtually everything really. So let's look at brushing twice a day. There is as a dentist, you see a huge difference to two people who say that they brush twice a day. One person will have immaculate teeth, the other person will have a terrible mouth, and they both are saying that they brush twice a day. So let's look at brushing in a little bit more detail. I've talked elsewhere on the website about how to choose a toothbrush and the brushing technique as well, and the fact that 2 minutes of brushing is a minimum, but 2 minutes is a very long time if you time it. Use the timer on your phone, for instance, or get egg timer 2 minutes and actually time yourself brushing for 2 minutes. You'll be surprised. The next thing is you do need something called interdental aids, so things like floss or things that get in between the teeth. That's because the bristles cannot get right in between the teeth where they meet each other, so you need additional help in order to clean these areas. Most people do not use any interdental aids. However, if you're going to have healthy teeth without visiting a dentist, then this is a must. On the website again I have described the method of flossing the teeth and how to choose the best interdental aid. It sometimes happens, in fact it often happens, that you use dental floss in some areas of the mouth where the contact points between the teeth are tight, but in other areas where the gaps are a little bit bigger you have to use an interdental brush, or even those wooden or plastic interdental sticks. You probably will be not surprised to learn that quite a significant proportion of people don't even manage to brush twice a day. I often get asked the question, which is better, brushing in the morning or brushing at night time? Let's look at morning first. If you are going to brush in the morning, it's best to brush after your breakfast. Some people brush their teeth before breakfast, but the problem happens then is you've just had your breakfast and the bits of teeth that remain between your teeth then stay there for the rest of the day, causing the build-up of plaque and causing decay and gum disease. So if you are going to brush in the morning, it's best to brush after breakfast. At night time it's best to brush again after your last meal, just before bedtime. If you had to choose between morning or night, it's better to brush at night from a dentist point of view, because you'll have cleaned your teeth, there'll be no plaque, and there will be no plaque during the next 8 hours while you're asleep, especially as at night time the amount of saliva that your mouth produces decreases, which makes you more susceptible to dental disease. However, to avoid bad breath, the best time to brush is after breakfast or after every meal. So in conclusion, the best time to brush is morning after breakfast, at night just before going to sleep, and if possible after a meal during the day as well, using the interdental aids. You can become a DIY dentist yourself by buying some disclosing tablets. Disclosing tablets are tablets that you chew in your mouth, and they have a dye in them which reacts with the plaque in your mouth. So the disclosing tablets, usually they come in either like a green or a blue or a red colour. So if you chew a blue tablet, for instance, and then you chew the tablet and then you spit everything out, if there is any plaque on your teeth, it will highlight on the dye will highlight it, so you will know if you are brushing your teeth properly or not, or you're leaving plaque behind. The common areas where people leave plaque behind is usually around the neck of the tooth, around the gum line, and this is incidentally where gum disease starts anyway. So continuing on to the 5-2 rule, let's look at the frequency of the sugar intake, which must be not more than 5. So we've said that most meals, if you have 3 meals a day, you can count that as 3 exposures, because most foods have either direct or hidden sugars in them. And then you're only allowed to have 2 further snacks during the day, so that gives the total sugar exposure to 5. And research has shown that by not having more than 5 exposures, you are reducing your likelihood of developing dental decay, obviously with the brushing as advised earlier on. If you have a snack, say if you have a bag of sweets on your work table and you have a sweet now, that's 1 exposure. And then if you have another sweet a few minutes later, that's actually counted as another exposure. And that's why frequent snacking can be so damaging to your teeth, because over a period of, say for example, half an hour, while you're having a bag of sweets, you could be having the equivalent of 5 exposures. So the key message here is that if you are going to snack on something, make sure it's quick, and then that's it, no more snacking. So let's look at gum disease, and let's assume that you've noticed your gums bleed. You will notice your gums bleeding because often when you spit out, the toothpaste will have traces of blood in it. The best way to identify where the blood is coming from is to brush a few teeth on one side at a time, spit it out and see if there's any blood, and then you do the same with another section, usually say 3 sections on the lower teeth, 3 sections on the upper teeth. It could be that you get bleeding on more than one side. So bleeding is an obvious sign that you have gum disease. On the section of gum disease on this website, you will notice that there are 2 basic types of gum disease. You have gingivitis and the more serious periodontitis. You cannot tell as a patient if you are one or the other. So all you know is that your gums bleed, and that is a sign of gum disease. There is a chemical which actually reduces the amount of plaque that builds up in your mouth, because it's plaque essentially that causes gum disease. So if you can reduce the amount of plaque building up in the first place, you are reducing your chances of gum disease getting worse or even starting up in the very first place. This chemical is called chlorhexidine. So there are different brands available, which I don't want to mention any particular brand, but if you just look at you ask the chemist, or you look up for chlorhexidine mouthwash, and then a few brands will come up, and they are essentially all the same because they all contain the same chemical called chlorhexidine. So choose one which is cheapest. The way you use it is you must brush your teeth beforehand as thoroughly as possible, because you mustn't have any plaque on your teeth to start off with, and then you spit out all the toothpaste. Make sure you spit out all the toothpaste, because the chlorhexidine can react with the toothpaste and that can discolour your teeth as well, but that discoloration is only temporary. So you've rinsed out, you've cleaned your mouth using the interdental aids as well, and you've rinsed your mouth out. Next thing is you take a little bit of the chlorhexidine mouthwash, usually far less than what they advocate on the bottle, and you swill it around your mouth for 2 minutes, and again a timed 2 minutes. The chlorhexidine binds onto the hard and soft tissues in your mouth, and the chlorhexidine prevents plaque binding onto your teeth. So theoretically the best time to use it is at night time before you go to bed. The other advantage of this is that chlorhexidine does have a distinct taste, so that's another reason why people do not like using it during the daytime, because it interferes with their taste of food at meal times or snacks. Chlorhexidine should only be used occasionally and not over a long period of time. Another DIY dental home remedy is the treatment of sensitivity of your teeth. You can use Sensodyne type of toothpastes. There's lots available, and they're basically more or less all the same, and the way to use it is to brush where the teeth, well, you can brush all your teeth, or if it's one particular tooth you can just dab some of that paste on there and leave it. Just spit it out, but just leave it. Don't rinse out with water afterwards, and that helps to reduce the sensitivity. Again, it's very useful just before bedtime, because then you are maintaining contact of that paste with your teeth over a longer period of time. Finally, if you really can't get to a dentist and you actually are having a problem, nowadays from the chemists you can buy an emergency DIY dental kit. There's various available. They have things like a mouth mirror, a probe, maybe a little spatula, a temporary filling material for crowns or fillings, and they can be messy and difficult to use, but I suppose it's better than nothing if you can't get to the dentist. Clove oil, also known as eugenol, can also be bought from any health shop or even from the chemist, and clove oil has a property that it numbs the pain up, so you could put clove oil into a cavity and it might soak into the cavity, numbing some of the pain. You can use it with for example, a small cotton wool bud. Dip it in the clove oil. Again, this is obviously not in place of proper dentistry, but just as an emergency measure to get you out of pain. It may work or it may not work. You still need to use painkillers for toothache, and if you're okay to take paracetamol and ibuprofen, you can take both of them in combination, because both of them in combination seems to work better than either of them on their own. In terms of any particular brand of paracetamol or ibuprofen, I would say get the cheapest, because they're just all the same. Nurofen is a type of ibuprofen, so you don't have to use Nurofen. Just ask for ibuprofen, because it contains the same ingredient as Nurofen and the other some of the more expensive brands. So this is a quick summary of, if you want healthy teeth without going to the dentist, how you can maximize your chances of reducing any problems that may occur. Thank you.